Well, once we had got over the shock of the diagnosis, what we noticed was that the medical profession was very slow to introduce change. And the reason that we noticed this was because there was absolutely no support available for me or for my husband Peter in the aftermath of this shock diagnosis. So not only were we getting over the whole shock of a very sudden, very unexpected, very serious cancer diagnosis, we had to come to terms with the idea that the doctors and the hospitals that we had trusted with my health had totally and entirely let us down. And they didn't want to talk about it at all. They were going to continue on treating me, no problem, that wasn't an issue. But nobody wanted to address the fact that things had gone wrong, how they had gone wrong, why they had gone wrong. They took it rather badly when we were sort of asking these questions about, is there going to be an inquiry? No, there wasn't. Are they going to report it to the health inspectorate? No, they weren't going to do that either. I had the option then at that point of saying, well, we can just shrug this off and allow that to happen to me and Peter and to all the other patients that this is happening to. Or we can sort of say, hang on a minute, hold on, this isn't right. And we've got to look at this more closely. What we wanted was, we wanted an apology from the hospital, which we didn't get. Although my doctor himself was apologetic, but only as a human being, not as representing the hospital. We had no explanation as to why this had happened, how they had managed to lose a cancer diagnosis in their system for 2 years, leaving me with a well-developed tumour that was actually, we didn't know it at the time, but we knew it was possible that I would be beyond curative treatment, and that was the case. I'm terminally ill now. And they weren't going to investigate it, they weren't going to report it to the health inspectorate, which we managed to get them to do eventually, years later. So we started to do what we could to change this very conservative, very secretive health system.